We saw the video. Did you like it? Yeah? Okay. If we are looking at the main things at the video, it is the hospital at home. Could you please tell how the home is looking like in 5 years from your perspective?
I think home is going to look quite same as today. There are some extras, for example, some services more, but I think and I actually hope that the home is looking like now. Not too much changes.
Well, I think the home for a healthy person might be very healthy, but we have a huge amount of old people and a huge amount of problems treating them. So I would like to wish that the home of the elderly people could be the place where they are treated more efficiently with digital helpers and new ways to take care of the elderly people. That's my hope.
Yeah, that's an interesting question, and I think that what we will see is a lot more tools for specific purposes in the homes. We done studies some years ago where when a chronic condition comes into a person's life, they also use their home space differently. But I do think also that the willingness to take in these gadgets and devices has a huge trust component, and it has to be easy to understand and easy to use, which puts a lot of pressure on us as providers and researchers, and also on the development community, because we need to stay away from the temptation that we should just have one more small feature. So, yeah.
So I'm a positive guy. No, but I don't think that there is much change in 5 years from now. And the reason for that is that if there would be change in the homes of people, we should have started like 5 years ago already. It takes a while before these things get into reality. And that's exactly the shift that's going to happen. Other industries than healthcare will shift these kind of technologies into the homes of people without us being involved in the things that they do. And involving ourselves into their programs and assisting them and helping them could improve also the lives of people living at home. Why is it that Apple is able to making me feel uncomfortable if I don't own the latest iPhone? Just imagine if we use that kind of psychological warfare to keep people adhere to the treatments that we've agreed on as healthcare professionals. And I think that is going to shift into the homes of people earlier than from us, with an open platform and open connections from outside in. So that's that Copernican moment that I mean.
Well, I'm a positive guy as well. Yeah. I will be a little bit bold. Maybe not in 5 years, but what I want to foresee is that subscription and prescription of home care solutions that can be, when needed, delivered to your home as a kit. There is kits for COPD, there is kits for chronic heart failure, there is kits for cancer rehab, etc. All these kits can be delivered to your home. Easy to install, increase adherence for your rehabilitation and treatment and monitoring. But then, of course, to facilitate this, I mean, there must be a system transformation. That takes a while. So maybe not 5 years. But the technology is there. You can still order, at least in Sweden, if you order medications from the pharmacy before lunch, you have it by dinner, at least in larger cities. So essentially you could get a package with the smart care at home installed. Yeah.
What I think is interesting when you're saying that we should have started 5 years ago, I think we did. When I'm working with a project which is called Nordic Smart Care at Home, where my vision is to bring is really to bring the hospital, but not only the hospital into the home. And then we start with everything. We see what is at home already. We have the devices, we have everything that we are either consciously or unconsciously following. So my next thing or to discuss here is basically, let's talk about what is smart at home, what is smart care from your opinion. And then again, like Lucien was saying, now there's a moment of truth, how much you have been having time to think about, do we need the smart care at home?
We do need some kind of smart care. But I think one problem is that that if we put too much technology and intelligence at homes, people become lazy. And you know what that means. When people are lazy, they are doing nothing also for themselves. That's quite a problem, because you can't move yourself with the technology. You can move yourself by your feet, and you need a lot of movement to stay healthy. If you are sick, then you are going to need that smart care. But if you are not sick, if you are feeling well, then you are really needing something else than technology.
Well, to continue from that, the most of our problems, healthcare problems, arise from the use of bad food, alcohol, tobacco, drugs, whatever. So I think the main thing which we need to do is learn to motivate people to take care of themselves. And I think that starts from the schools. And like in Finland, every school day almost every day has a gymnastics or whatever physical exercise. I think we should bring that to the homes and to the workplaces. We shouldn't stop after the school. So, but the chronic diseases, they come from, most of them come from the problem that we have. We are not enough motivated for losing weight or doing exercise or eating healthy or whatever. So maybe we should change society thinking what kind of humans we want to be. But that's a big ethical question also. So can we push people that you have to be, your lifestyle needs to be healthy, otherwise you can pay more taxes or whatever. So these are big questions, and again going a little bit out of the smart care, but I think we should first discuss about these ethical and moral and political questions before we can dutifully implement smart care. I would really like to go to the doctor at a supermarket. It's much more easier than go to the health center in Finland nowadays.
Yeah, to add one piece to that, when you're healthy, you need many things. But when you're not healthy, you're sick. You have only one need, right? Okay, and that need, we are setting our focus in lifting up the need. And when we are looking at what we are talking here, we have the technology, we have the solutions, we have the care models, we have the infrastructure, and then we are talking about the home. In what way do we make the need and the will to meet?
Yeah, I'm not going to answer to the question, but I could echo it. What I would say, though, is that I don't think that we do have the tools yet. I don't think that we do have the technologies yet, because what would be smart in terms of the life journey is to make the good choices from the very beginning to the very end. Like we've done with the undernutrition problem, we know that it creates a lot of problems. We try to teach the elders, the older adults, that it creates a lot of problems if you don't eat properly. Sometimes you cannot do anything about the problem, but this issue of, and the big questions of prevention and everyday choices to stay out of the healthcare system. I don't really think that we have the tools to address those topics. So I would challenge the entire panel, me included. I really don't think that we do have, that we have seen what the tools and the services will be if we as societies would be smart. We have a lot of ideas that we're trying, and it's like an ongoing living experiment, but we haven't seen the tools yet.
I do agree. So that's first of all. Answering the question in terms of what is smart, I think smart is depending on who's asking. Smart, if you ask the question to a healthy citizen, would give you a totally different answer than somebody who's living with a chronic condition. We've seen this happening in the Netherlands, where we had to ask for the parliament whether or not there should be a nationwide medical record. And the majority of the people said, no, I don't need any of those. But the majority of the people with the chronic condition say, yes, please do, tomorrow. And I think that the majority of the policies are being made in parliament, at least in the Netherlands, not in Finland, by healthy people. So asking the question is also funneling it, I think, in a wrong way. And if smart to me is that it collides with my need at that moment. And I've worked a lot with young people with cancer in the age of 18 to 35 years. And due to protocol, we've asked them to every 6 weeks come into a consultation of 15 minutes in the clinic. And we would ask, how are you doing? And they would say, well, that's fine. That's it. Then they're off. But then they would say, last week I needed you for over an hour and you weren't available. So smart for me is also giving choice to patients to ask healthcare in a smart way. That could be with tools or physical, but also to de-escalate again as well if it's not needed. If you would say, I'm fine with sending you an email message that I'm fine, I'm doing okay. And that's the strange thing in protocols that we use right now. It's either or. It's like there's only one kind of patient, there's only one model. I think our society now is building towards a smart society where we have all kinds of choices. And that, to me, also should be the answer in terms of smart care in your home, with tools that will come up in the end.
It's I'm always last, so I
You're the first one
no,
to stop answering.
I completely agree with all of you. And taking up the note here with Anemon, the life journey, being smart is, I think, is being flexible, because the life journey is a very heterogeneous process. I mean, there is completely different need during your life, and as Lucien said, that the healthcare policies are stipulated by healthy people, which is a very homogeneous process, which is not very good. So being smart, I think we need to take into account the different life stages, what is needed, what can be done with nudging, adherence when it comes to prevention, which is an area that is both scientifically not very researched at all, because we are focusing on already sick people. I think that is the hidden factor, or the hidden gold mine when it comes to actually alleviate the burden that we have on the elderly people, to make them more healthy 20 years before they are going to be sick. But today, for example, in Sweden, I think we're putting down 1% of the complete healthcare budget in preventive measures, which is, I mean, it's ridiculous. But investing in preventive measures that cannot give effects within the year or even within within 5 years. I mean, the healthcare system and the politicians, they cannot comprehend that. And maybe that's because they are healthy and not sick. So I think adaptive systems.
Can I add on that note? What we have learned is that the time frame and the perspective of decision makers are so short because they need to be re-elected. Politicians need to be re-elected. They need to demonstrate results in 4 years or even less depending on the democratic system. And then the policy thing is very difficult because they are also elected based on demonstration of results. So demonstrating the effect of that nothing happened, which is actually what we do with prevention and early intervention, is absolutely under-researched and not well understood at all. But like we estimated that if we can keep a person in Oslo at home for 1 more month in their lives, we save 10,000 euros for each person. So just think about those KPIs. What there is in broad, focused prevention and easy-to-use tools. And then we're actually talking same type of money, but with different perspectives as compared to big pharma and life sciences and all the Internet of Things and everything. So it starts with the person in the home.
We have usually in healthcare, we're happy when we get one healthier day a time. One healthier patient at a time. And Lucien was in his presentation very much emphasizing the role of education starting from the ground level. But at the same time he was saying that it takes a generation basically to make it happen. Okay, here we are sitting, we are both patients and caregivers and making it possible to have a better care today and tomorrow. So my question for challenging you next round is that what can we do here and now to make everyday life a healthier one?
And then we'll go all the way over there.
Thank you, Mina. Let's see. I got a little bit stuck about your take-home message, Lucien, when it comes to... I just want to emphasize that to have this transformation process going, we need the ambassadors. We need the ambassadors in the top management, both when it comes to politicians that do not focus on the 4-year kind of time frame. But we need also the people within the top management of the healthcare systems. But we also need the ambassadors on the floor, the nurses, the caregivers that is actually handling the care. I'd like to utilize a nanotechnology terminology in that, top-down, bottom-up. It's usually quite effective because the really slow process is in the middle segment of all organizations. And I think if we can manage that, if we can attack and convert those different kind of organizational shifts, I think we can manage that. Now, what was your question, Mina? I can end with that, so I hand it to Lucien.
I'll go back.
Well, actually, we need different kind of choices, and also show to the people, to the citizens, which are the good choices. And there is a lot of policies that can do it, but actually there are really small things that you can do. For example, in markets, do you put all the candies in front of the customers or the vegetables? Which are easier to collect to your bag? So make those choices easier, which are better ones. That's one way.
Well, I'm thinking about money. We are now sitting in the Kuopio University Hospital, which has a 10 million euros budget, minus budget right now. Because of that, our educational budget was cut 50%. 1 million euros was taken out of it, and we still have 9 million euros to refill. You talked about the COPD program. I'm an emergency medicine doctor, so I can see that it's really, really important. And Finland has a lot of diabetics. Diabetes 1, diabetes 2. It's very popular. It is very, very common disease. Very popular here. And yeah. Well, it is popular because we're getting fatter and fatter all the time. So, and we have tools for that. Continuous blood sugars measurement. But our patients are not able to get them because we don't have money. So, isn't it a bit crazy? We need to, and where do we put the money in? We have to think about, we really have to start prioritizing. And when we think globally, this problem is so much different. Every day, every second, there's a child dying because of diarrhea, because of not getting clean food or whatever. So the healthcare problems globally are completely different from the undeveloped countries. To compare these Nordic countries, we're so sad because we don't have time and money to take care of our old people. So I really, really want our politicians to start thinking longer than 4-year period. We have been. That's one thing. We need to start thinking citizen democracy and citizens internet democracy. Perhaps it was a very interesting topic.
Skip the politicians, please. No, really. I think it's very important that we still have a democratic process, but they're only in the game for 4 years. We all know that. But there is a next layer underneath them, the civil servants that will stay. And in my coffee break with Nima, I also addressed that third layer of power that will stay and that you can influence and that you can invite and bring them into your own practice, into the ER, and show them firsthand what's happening. Help them with creating the right policies by creating a report or some suggestions how to do that in the end of the day, and then hopefully find the right politicians. I stopped aiming at politicians. For the last 11 years, it brought me nowhere. Because at the moment in time when they were ready to take on that bill, crisis in parliament, send away, you guys and girls come in, takes 2 years to get them up and running for the first time that they visit your hospital, and then you're out. So again, there's a third layer of power, people that are in the game for a long time already, help them with their challenges with a new boss that says, no, now we're going left ways, and 4 years after, now we're going right ways. Try to find that common pathway in it. And I think research is very important for that. The things that are stepping up right now is that there's also going to be citizen science with all that data collected. To your point of diabetes, completely correct. And again, I don't own any shares of Apple, but Apple is working on a device embedded in this same system for diabetes control as well, like $300. Still is a lot of money. And if we were also able to broaden it also in developing countries where they have network coverage that I'm jealous at in the Netherlands. I got not everywhere in the Netherlands I got network coverage. In Africa, in the majority of the places you still have network coverage. I think we can create also global health for that, hopefully.
Thank you. Since I brought up the point of politicians, I would like to add a fourth layer actually, and that is us. It's all of us. And it's what we are doing on a daily basis. And it's obvious for me to talk about what we eat and the food choices that we make on a daily basis. But it is also, when I work with elderly, it's actually quite simple and difficult. Good health as you age is about is about four things. It is about physical and social activity so that you stay fit. It is about hearing aids and glasses so that and other sensory stimulating things. It is about nutrition, and it is about your cognitive health. And it is those four things. And then, of course, if you have acquired a chronic condition, that adds to the burden. But for the most of us, if we take care of those four things, we're also contributing tremendously to a smarter society, and which we are actually contributing to shaping our life journey. And I think that is a lot about being smart and about being and also thinking along the lines of smart care. Because if we can be smart and stay away as long as we can, and help ourselves, help our neighbors, build communities, we are contributing tremendously to those that need smart care, that comes to the ER, that needs the services of Kajsa, Maria. Was that pretty? Yeah? For example, that they are not competing with too many others, so that we can. So it is actually thinking as the fourth layer, as citizens, what is smart today, and actually make small adjustments. Thank you.
Right, and as the time is running, I will have one more discussion topic very shortly from all of you, and it's actually a next step, continuing the Anne. It is that it is us. So when we are talking about smart care, and we're talking about tomorrow care, and then we're talking about us, and then we're talking about opportunities. Isn't it a little bit that we are also lifting the responsibility and putting it more and more to the individuals as us, and at the same time, as we have created so that the people are more aware of the weight, of the eating, of the sleeping, of the social networks, of everything, to be aware. Is that smart? So the last part is that the opportunities of smart care and then connecting the people. If you have any comments on that, I think that will be a good place to round this discussion up. And if you have any questions or comments on this, let's do this round first and then have the question. Yeah, very shortly.
Very shortly. Yeah, I think one big thing is that we have to be moving all the time. We can't stop, because if we have some kind of silos to break, then we need power, and you get more power if you have more speed. So when you are all the time moving, then we can break the silos, and that way go ahead.
I'm a sad pessimistic, in a way. I can see our society getting more dualistic. So there are people getting more poor, getting more bad choices, more bad habits, and there are lots of people the other end with getting more richer and more healthier and more vegan and whatever. So I think we need to start from the school. From the school, make this society great again.
Well, what can I say? I share the concern for growing inequalities. Digital divide is very much there, here and now, and it is more than an urban-rural thing. But I would also, as a final statement, I would say that blended with all the opportunities and promises, if we're doing it right, innovation will travel at the speed of trust. And trust, and being in Finland at these times where we know that trust is a highly valued quality, is very exciting. But innovations and all the changes and whatever we want the citizens to do, it travels at the speed of trust.
Trust as the new currency, right?
Not so much Bitcoin anymore.
Okay. Well, maybe it's about you. Last week I was also in a panel and we debated how much of the things that you yourself can do tomorrow. Let's face it, you all have a job. Some will be in communication, others will be in research, some will be in engineering and all kinds of stuff. Why don't you step up to your GP or to that elderly home and offer 2% of your living time, which is like 8 hours, and spend that in that elderly home, or help the GP with your communications background to help them to get the message across and do it better. If we all collectively would add those 8 hours per year, which is 1 day, just imagine what we could be doing.
No, to sum up, I got stuck a little bit in the inequalities. I think that is something that we need to address, and that all of us as fellow beings should fight for that, because when it comes to health and care, that is the basic level of a modern society. We need to change the culture. We need to facilitate processes that all of the population should have a really good and good healthcare, basically. Yeah.
We can take that later. Yeah, we're looking at the time. Time is running, as always. We will take the questions on the break. That is after the short presentations. So I thank you for all the panelists. Very nice. Thank you.